Welcome to Medical Dialogues. I'm Roshni and today we're going to talk about an interesting case where a bullet was removed from a Yemeni patient's lung after 2 years. A remarkable medical achievement, Aster RV Hospital in Bengaluru accomplished a feat in cardiothoracic surgery by successfully removing a bullet embedded in a 21-year-old Yemeni patient's lung for nearly 2 years. The patient, known as Wasim, the young man sought medical attention due to persistent cough, breathing difficulties, and blood in his sputum, unaware of the hidden danger lurking within his chest. To talk about this case in detail, we have with us today Dr. Divakar Bhat, a cardiothoracic vascular surgeon at Aster RV Hospital. Welcome to Medical Dialogues, Doctor. So, Doctor, can you tell us the case history?
This is Yemeni's young boy, maybe around 25-year-old gentleman. He had come with a history of some sort of trauma to his right side of the right shoulder, right hand, arm, and right chest. These lesions were tackled in his country only by probably orthopedic surgeons and general surgeons. This was happened in a sort of gunshot injuries. Probably he was involved in a war scenario. He did not give us the detailed history how the injury happened, but one thing he knew, there was one bullet entry to his chest, and those doctors were concentrating on shoulder injury and his arm fracture. All those things they tackled nicely, and I think within 2-3 months those things were sorted out. But that bullet was sort of neglected, and he was continuously having cough and chest pain, lower part of the chest on the right side, and mild fever and myalgia and some sort of uneasiness. So no doctors could identify, and then he somehow landed up in Aster RV Hospital, maybe because of the name which this hospital has, or this Aster brand has in this part of the world. So he thought probably the Aster doctors will give him relief. When he came to us, he landed up in pulmonary department, that is lungs department, because his main complaint was cough and chest pain. So our doctor pulmonologist, Dr. Pawan, immediately he got a chest X-ray done, and to his surprise, he could see a large bullet lodging in his right lung, and immediately he sort of related all these his complaints and this finding. So this bullet was the culprit for his chronic cough, chest pain, mild fever, myalgia, uneasiness, all those things. So he went ahead and did one more CT chest to confirm the bullet and the location of the bullet. So the CT chest proved that the bullet is inside his chest, right chest, and it is in a very complicated region where between the right lung, heart, and diaphragm, we say. So this area is very difficult to approach by any surgeons, and then he thought of me, and he referred the case to cardiothoracic surgeon, and I am the cardiothoracic surgeon in Aster RV Hospital.
Right, so what were the complications that you faced during the procedure?
The thorough preparation of this case, that is adequate thought process before going into the chest, made this case complication free, because I could have injured the diaphragm, I could have injured the lungs, I could have injured the heart. Since CT scan was telling us exactly the location of this bullet, size of the bullet, the depth from the skin, everything was sort of planned, and we executed our plan accordingly, and the bullet could be removed without much difficulty. So proper general anesthesia and proper planning was the key in this case, and avoiding the complication is the main thing. There lies the experience of the surgeon, and finesse of the surgeon matters. We had taken probably adequate precaution, and patient was lucky, and we were lucky to not to land up in any sort of complication.
Well, that's really nice. So what are the prognosis, doctor? Is the patient well now?
Nothing. These are sort of cures. See, one foreign body was lying inside his lungs and causing some sort of infection around, and that is the reason for his mild fever, myalgia, and uneasiness. So the moment we removed this, his general symptoms had improved, and he was a different man. And in fact, he wanted to go home third day only, but we made him to stay in India for one more week. And though he was discharged from the hospital on a third day, we made him to stay in Bangalore for one more week. We removed the sutures and we made everything is absolutely fine, and then we allowed him to go to his country.
Right, doctor. Thank you so much for your time and for your insights. The case was managed extremely well with tremendous efficiency and expertise of Dr. Divakar Bhat and his team. Salute for giving new lease of life to the patient. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.